you're gonna gather all your supplies before you perform this task. You need to make sure you have your measuring cup and the drainage volume chart form. Once you have everything staged, you wanna make sure that the patient is in a comfortable position. The best position is either sitting as the patient is now or laying. Once the patient is comfortable and you have all your supplies staged, you're gonna wanna then put on some gloves. Whichever gloves you have at home is fine, as long as you have gloves on. After that, you are then going to visualize the lowest point of the drain that you can see coming out of either the surgical garment or the dressings. You will then, with one hand, you will grab that lowest point that you can see. You will hold down on that point, keeping positive control. With your other hand, you are going to come down. You are going to lightly pinch, squeeze, and pull back on the tubing. You're going to do this all the way down the tubing, all the way to the bulb. You are going to want to do this 1 to 2 times, twice a day, just milking. And as you do this, you should notice the fluid moving from the tube to the bulb itself. And again, you want to milk this twice a day, morning and evening. After you have completed milking it, you will then unclip the bulb from the patient. You will then hold the bulb lightly. Don't squeeze on it, because when you take the top off, if you are squeezing too hard, it will squirt out. So you're going to hold the bulb lightly. You will then take the top off. You will notice it decompress if it is not already decompressed from the amount of fluid in the bulb. You will then take the measuring cup. You will notice the measuring cup has markings on one side of it. It has ounces and milliliters. You want to make sure you are using the millimeters measurements for the amounts that you do get. You will then hold your cup with one hand, tip the bulb over, squirt out the fluid gently until the bulb is empty. If there is a little bit of fluid left in the bulb, that is okay. Once you've drained it, you will then set the cup aside somewhere that it will not spill. You will then squeeze the bulb, compressing it as much as you can, replacing the top. And then you will let go, ensuring that the bulb remains compressed. And you should notice some fluid moving through the tube. You will then clip it back to the patient. And then you will move forward to get your measurement and empty out the cup. So you will again refer back to the drainage volume chart form, which has 4 columns, a date, time, left, and right. So you will fill out the date that you were performing the task, the time that you were performing the task. Try to be consistent, because you want to drain this at least twice a day, just milking, but you want to try to do the same time every day. And then depending on whether it's the left drain or the right drain will depend on where you put the amounts. And again, you want those amounts to be in milliliters. And you need to do this every day until the drains are removed. And you need to make sure that this form is kept up with and kept somewhere safe so it can go with you to all your appointments, so your surgeon knows how much drainage is coming out of your drains. Okay, so from the patient's perspective, in case your caregiver is not available to help you with your drain care and maintenance, this is how it is done. So what you're gonna do is you are gonna make sure you have all your supplies, which include the measuring cup to dump the drainage in and measure it, and the form to fill in once you've measured the drainage to keep it documented. Once you have your measuring cup, you're gonna stage it next to yourself so it's easy to reach. You'll notice on the measuring cup there is a markings for the measurements. There is an ounces side and a milliliter side. You're gonna wanna document your measurements in milliliters, not ounces. So to start, you're gonna visualize the lowest point of the drain tube that you can see either coming out from your garment or a dressing. With one hand, you are gonna grab the tubing, you're gonna hold positive control of it. With your other hand, you are gonna come up to your fingers, you're gonna pinch down lightly, and you're gonna pull back. As you are pulling back, ensure that you are pulling only on the tubing in between your 2 hands and not actually pulling on yourself. You are gonna milk all the way down to the bulb. As you are doing this, you're gonna wanna visualize that the fluid is moving from the tube to the bulb. You're gonna wanna do this 1 to 2 times each time you do it. And you're gonna wanna milk it at least twice a day. Recommend morning and evening before bed. However, you are only required to drain it once a day unless otherwise indicated by the amount of drainage you have after surgery. Once you are done milking the tube, you are then going to unclip the bulb from either your surgical garment or clothing, wherever you have it clipped to. You are then going to make sure you are holding the bulb lightly, because if you are squeezing on it, when you pop that top off, the fluid will squirt out onto your hand or your clothing. So holding it lightly, you are going to remove the lid. You should notice it decompress if it is not completely full. Once you have removed the lid, you are then going to grab the measuring cup. You are going to tip the bulb over and gently squeeze the fluid out into the measuring cup, ensuring that all the fluid comes out. However, if there is a tiny bit in the bulb after done, that is okay. Once you have finished draining the bulb, you are then going to set that cup aside somewhere that it will not spill. You will then squeeze the bulb, compressing it completely. You will then replace the lid and let go of the bulb, ensuring that the suction remains by the compression of the bulb. You are then going to clip it back onto your surgical garment or piece of clothing, wherever you prefer, to ensure that it is secure and not hanging freely. For the clipboard, you have 4 columns total: a date, time, left drain, right drain. So you will write the date that you are doing this, the time you are doing it, and then depending on which drain you are draining at the time, you will write that in either the left column or the right column in milliliters. Okay, so while you are taking care of your drains and draining them, you're going to want to make sure that you are watching them and ensuring that there are no issues that arise with your drains. So one of the issues I'm going to go over is if there is a clog or a block in the tubing. So while you're going through the milking process, if you notice that that fluid is not moving from the tube to the bulb, then that means that there could potentially be a block or a clog somewhere within the tubing itself. However, don't panic right away. Still continue your steps of milking and draining the bulb. After you've drained the bulb, you have a nice empty bulb with good strong suction. Just go through the milking process again. So you'll clip the bulb back to the patient. You'll come down with one hand, grab that positive control. With the other hand, you're gonna lightly pinch and pull back. And just see if the fluid starts moving through the tube to the bulb now that you have that nice, fresh, strong suction again. If the fluid does start moving again, then you know you're good. If it continues to not really move and it stays where it's at, then that means that there is a potential for a block somewhere. But just keep an eye on the bulb, see if the fluid does collect in the bulb, because if it does, then you don't have a block. If there is no fluid collecting in that bulb, then you'd want to give our office or our urgent hotline a call so we can reach out to one of the surgeons and talk to them about what's going on with the drain to see if they would want you to come into the office or into the surgical center to have it assessed and potentially, fixed with whatever process we have to go through. The other issue you want to watch out for is if the bulb itself does not create that good suction seal. So if when you're done draining it and you have your bulb open and decompressed, you're gonna compress it, you're gonna cap it. If when you cap it, if you notice that the bulb just decompresses again, then that means you do not have a good seal in your drain. And there could be a leak somewhere in the tube, down at the insertion site, or in the bulb itself. Now with that, you're just gonna wanna check it again. Compress it, put the lid back in, and let go. If it decompresses again, just simply put the lid back on, give our office or our urgent hotline a call, let them know what is going on so they can let one of the surgeons know and the issue can be addressed appropriately. However, if you do check it again, you put the lid back on and it stays compressed, then it could have just been a simple issue of the lid maybe not sealing appropriately. But these are the 2 biggest issues you want to make sure you keep an eye out for when maintaining these drains.